You're listening to the Assembly on Behavioral Science and Health Services Research podcast, brought to you by the American Thoracic Society.
Hi, everyone. This is a podcast episode for the American Thoracic Society, hosted by the Behavioral Sciences and Health Services Research Assembly. I am your host for this episode, Dr. Amanda Wilson, Assistant Professor in Public Health at the Mellen Enid Zuckerman College of Public Health at the University of Arizona. And I'm very excited to introduce our guest for this episode, Dr. Ashley Lowe. Dr. Lowe is an assistant professor and implementation scientist at the University of Arizona with appointments in the College of Nursing and the Asthma and Airway Disease Research Center. Her research addresses pediatric asthma disparities through evidence-based interventions and community engagement. As director of the Stock Inhaler for Schools program, she oversees the nation's longest-funded school-based research initiative, serving over 850 schools across Arizona. Dr. Lowe's expertise in clinical research and dissemination and implementation science informs her work in translating research into practice, influencing policy, and fostering partnerships to advance equitable healthcare solutions. The focus of our episode today is on community engagement from the perspective of a non-clinical researcher trained in qualitative methods and implementation science who has been working with a number of communities over her career. We'll discuss things like, what does it look like to build these relationships from the ground up? What are the biggest takeaways from these projects, and how have they influenced policy? What are strategies for clinical and non-clinical research partnerships in serving communities through research? And what are some strategies for successfully getting this work funded as an early career stage scientist? We have no conflicts of interest to disclose. To set up our discussion for today, we first want to talk about what do we mean by community engaged research. Community engaged research is an approach that has become increasingly important as the health issues communities face around the world grow increasingly complex. It also enhances the ethics of research because it supports fair and just work that serves communities as opposed to simply using them to achieve some academic end. But how do you get started in community engaged research? What does it look like? Today, we're going to explore the experiences of Dr. Ashley Lowe, who has been working with school districts on stock inhaler interventions, working with Indigenous communities to improve indoor air quality, and more. She interfaces with clinical researchers and non-clinical researchers who may be bringing differences in training and/or fundamental differences in how they approach different problems. By the end of this discussion, our hope is that listeners feel inspired to incorporate community-engaged research in their own work. And we'll walk away with some practical advice on how to manage team dynamics in accomplishing this important work. Dr. Lowe, thank you so much for your time and talking with us today. Can you tell us a little bit about how you got started in community engaged research and what the term community engagement means to you?
Well, thank you, Dr. Wilson. It's truly an honor to speak to the ATS community about community engaged research. And I would say my journey with this approach began really early in my academic career, specifically during my time as a graduate student. So I do have a background in public health, and community engagement is really a core principle in public health and also in conducting meaningful and real-world research. So as a public health graduate student, my coursework was complemented by also my hands-on experience as a research assistant. I was at the time working with my long-term mentor, Dr. Lynn Gerald, on school-based studies, which predominantly focused on improving asthma care in the school setting. And so from the very get-go, I not only received coursework, but had hands-on research experience where I learned the importance of integrating community engagement into the research process as it pertained to school-based research. So I think the second part of your question was, what does the term community engagement mean to me? And so for me, community engagement means collaborating with the community well before the grant writing process or before you come in with a proposed idea that technically would benefit the community, right? So what I see often happen is researchers will enter a community with a predetermined idea about what they believe the community needs. And usually it's well-intentioned. They want to create impact and have a beneficial project. But in order to create impactful and beneficial projects, you first have to build the relationship, right? And then listen to that community to understand what it is the community truly wants, but also what they need. So in all of my community-based projects, mostly the school and tribal communities that I work with, this relationship building phase, we could even call it pre-implementation for our implementation scientists out there, it's absolutely necessary and essential. So before solidifying an idea, a research idea or proposal that you intend to write into a grant, prioritize meeting with those from the community. So members who might be vested in your idea or decision maker need to make sure that your proposal or your idea aligns with what their priorities are and also to make sure that the project is even feasible for the setting. So it's important to involve many people during this preliminary approach to submitting a grant proposal or having a project. And it needs to be collaborative during all stages of this process, but especially in the beginning, that you're making a relationship, a long-standing relationship with the community so that the work reflects shared goals and truly creates real-world impact.
Thank you. I love that. I love the work reflects shared goals. I think that, approaching as a true partnership is ends up creating a very fruitful project with big impact. What are some communities you've worked with in your career so far? I know you've mentioned a few, but I wondered, across your career, who have you worked with? How long has it taken to build some of those relationships?
Well, so most of my large projects work in two main areas, schools and tribal nations. And so I've actually worked in schools on tribal nations, right? Specifically the Navajo Nation, which is located in the Four Corner area of Arizona and the southwestern United States. So those two communities really kind of schools encapsulate, several communities. So I also tend to work with a lot of rural schools, and they do have, I would say, different level of resources and things that to be considered. But it's interesting having the experience working in different types of schools and settings because we basically, for the Stock Inhaler for School program, where we're working with 800 plus schools, it's somewhere around 850. Our rural schools have different resources than, say, the schools that are located within our metro areas. And because these schools represent a diverse mix of urban, rural, and tribal communities, each school typically has a unique need and or challenge that has to be addressed. And so I think the diversity kind of underscores the importance of tailoring our approach to meet the specific priorities of each community or school that you're working with. And so I typically engaged directly with the schools and community members. And sometimes those community members are actually organizations. It could be the county health department. It could be the superintendent's office. But you want to ensure that the research addresses the local context of that community. So that way, when you come in with a proposed idea and an evidence-based strategy, you can then kind of look forward and towards and create a sustainable outcome. And so you asked me how long I have been working or, to build some of these relationships. And it's been from the very beginning of my graduate training. Most of these relationships have taken a decade to create and sustain over time. And so it's really important to emphasize that this particular work doesn't always happen overnight and that it does take a long time to establish those connections and work with decision makers in whatever population or setting you're working in.
That's amazing. There's a lot of continued commitment to those relationships. I want to focus specifically on your stock inhaler research. What have been some of the biggest takeaways from that research in partnership with schools, and where is that research currently headed?
Sure. So just so I guess our audience knows, the Stock Inhaler for Schools program is a program that we implement here in the state of Arizona that ensures access to albuterol sulfate for K through 12 school children. That program has been consecutively funded and running for the past 8 years, I think since 2017. And really, it's critical to think through, how a research study can be consecutively funded and really working towards a sustainable outcome when the funding runs out. So that's one of the priorities that has been really important to me, is making sure that since we're working with communities, we're not just going in with some grant money, collecting the data we need, and then saying goodbye once the funding runs out. And so right now, I see the research headed towards a few things, but specifically really working on sustainability, how we can build that system to ensure that schools have exactly what they need, the tools and their toolbox are one way to describe it, when we kind of take a step back and allow them to take over implementation and sustainment of the program. So what that means is creating systems that are adaptable to different contexts. Again, kind of going back to the unique context of the community in which we're working with, right? So whether it be urban, rural, tribal, but just ensuring that they have the training and the implementation strategies that are feasible for the long term. And I would say that our research is currently evolving to focus more on sustainability. What we're trying to do is address the funding constraints and explore cost-effective models. We're also prioritizing partnerships with local leaders to ensure the program continues to reflect the priorities of not only the schools and communities it serves, but everybody. So as our funding cycles change, we're kind of leveraging these partnerships to secure additional support and develop those sustainable solutions that are scalable and also community driven.
And I would imagine, on that note of sustainability, the idea of policy comes up. And I know this work has influenced policy, and I wonder, what has that experience been like? What kind of team do you need to achieve that level of impact?
Yes, the policy, influencing policy has been incredibly rewarding, but it is challenging. And so I would just like the audience to know that it is no easy feat to change policy. It definitely requires collaboration with countless individuals, those from the community, educators, researchers, but you also have to be able to work with lobbyists and policymakers, right? And so one of the biggest lessons that I've learned is from passing legislation here in the state of Arizona. It really is, in the words of my mentor, Dr. Lynn Gerald, after the policy is passed, that's when the real work begins. So anytime a law is passed, you have to focus on implementing it effectively and ensuring that it achieves its intended impact, right? So, right, we passed policy to have the Stock Inhaler for Schools program in 2017. But what was really important about that initial law being passed was evaluating the results of the policy. And we realized when we passed the legislation, there was actually language that wasn't included in the law that should have been included. And so we had to be willing to go back and make modifications to improve the existing law, which again is not starting from zero, but, kind of going through that whole process again. So it's a lot of work again. And so now we're 8 years later. We're actually evaluating the policy again, the legislation that was passed or actually revised in 2018. And so for a second time, we're trying to go back and incorporate the lessons that we've learned from our earlier efforts. So definitely requires a multidisciplinary team. You have to have the diverse expertise. You have to have a shared vision, but you truly have to have a deep commitment to community engagement.
That's amazing. I love that, idea of iterative learning and improvement to this effort across many years. You mentioned the teams that are necessary to do this type of work. And I know it often requires researchers with many different backgrounds, some being clinicians, some being non-clinicians. And I wondered, as a non-clinician, what advice do you have for clinicians who are engaging in research, maybe looking to collaborate with people who are non-clinicians? I know sometimes there's cultural differences. What advice do you have for building a team that communicates well and utilizes the strengths of, differing perspectives or differences in training?
Oh, that's a great question, because interdisciplinary is where it's at, in my opinion. My advice for clinical researchers is to embrace the power of interdisciplinary collaboration. So non-clinicians and clinicians both bring unique skill sets and perspectives, right, to the table. And so when we work together, we can complement each other to strengthen both not only the research process and its outcomes, but the, community engaged process that we're trying to achieve. So in my own experience, I've actually never written a grant that didn't include a clinician. And I believe the same approach should apply in reverse. If you are working on a grant proposal and you want to conduct community engaged real world, studies, you're definitely going to need a non-clinician on your project. And so once we create a team, I think that resonates deeply with the communities we serve, that interdisciplinary approach. When I go out to my school and I'm speaking to school nurses, the person that they really want to hear from is another school nurse or a licensed nurse who can speak to them and train them on what they need, right? So if I'm not including somebody with a license, I'm doing them a disservice, right? So I think just really being open to different disciplines and leveraging the diversity and expertise, that's what allows us to design and implement projects that are, not only scientifically sound, but also meaningful and impactful to the people we work with.
Thank you. That's useful advice. Our last question for you is, you recently had an R1 funded, yay! And in your first year as tenure track faculty. And I know there's a lot of folks who are thinking, I want to do that. How do I do that? So what advice do you have for junior faculty looking to get their first R01 funded?
Sure. Okay. Well, it's okay to not be funded on the very first, year of being an assistant professor. I think persistence is really always the biggest key to success, right? But yes, I would say that part of my success and accomplishing this was mentorship. It was all about mentorship. I have been absolutely blessed with a career of mentorship. And again, I've mentioned my long-term mentor, but I have different mentors that are interdisciplinary, right? So I have a clinician who's my mentor. I have a person at the College of Nursing where I'm faculty as a mentor who's a little closer to my timeline in the career path, right? And so I have different mentors. And for that reason, I believe as junior faculty, I was given a lot of direction that really helped me be successful in securing an R01. I would also say prepping early. It took me over a year to write that grant, and that was, of course, based off of well-established research that had already been occurring for years. And so I think if you are junior faculty and you're starting to, prepare for an R01 submission or any grant proposal, you want to start the process early, identify strong mentorship, and then build those strong collaborations And those things will help you successfully navigate the R01 process. And I also would say that it's also very important, and one of the reasons I believe my application was successful was to make sure your research aligns with the funder's priorities, making sure that the grant proposal actually reflects the significance and impact of your work. And again, kind of going back to my original point, just persistence is key. I think that we all in academia experience rejection, and that's just part of the process. So overcoming that and using, critique as a way to strengthen the proposal is one of the most important things for us to remember. And then again, just back to the mentorship, you're not doing it alone. So don't try to make sure that you are working with mentors who are key to your success, because they are those who are going to help you leverage your network. They're going to give you feedback, and they're going to also help you build that team that is going to, bring success to your vision and goals.
Excellent. Well, thank you so much, Dr. Lowe, for sharing your experiences, thoughts, and wisdom today. I wrote down the words persistence and commitment, whether it's an R1 or starting a relationship with a new community, or building a vision with that community, building a team to serve them. I think that listeners will learn so much from what you shared today. If you enjoyed this topic and you want to hear more, join us at the upcoming ATS 2025 meeting in the Symposium Community Engagement for Pulmonary and Environmental Health Research, Lessons Learned from Community Partners, Site Access, and Recruitment. Hope to see you there, and wishing you a great start to the new year.
Thank you.
Thank you.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more podcasts from the ATS assemblies on YouTube. Don't forget to like, comment, and subscribe so you never miss a show.